is a chance that they could do one of three things. One, cold feet, long journey, country in crisis. It is possible that Congress will decide to abandon this effort. I have been doing this for over a year, and I have never said that. But at this moment in time, it is entirely possible that Congress may not do comprehensive health care reform, and may in fact do nothing. I was on a conference call with hundreds of people yesterday across the whole country when we got our marching orders. Two, Congress could decide to do something very, very watered down. Tinker with insurance regulations a little, maybe help a few people get Medicaid, that kind of thing. It would be a lot less than the 30 million we're talking about and the significant changes to affordability. That is entirely possible at this time. And three, Congress could still pass comprehensive health care reform with all of the things that we talked about. Now remember what I said, all the things that I covered were in both bills. So no matter who wins in terms of the bill and the negotiations, unless they take it out, that's what's in both bills. This could still pass through Congress, and the way that that would have to happen at this point is that the Senate bill, which does a lot less than the House bill, would have to get passed by the House of Representatives. That bill then could go to the President's desk for signature. A bill has to get passed out of both houses of Congress, and then the President has to sign it. So the Senate has already passed a bill. So we don't necessarily have to take the whole thing back to the changed Senate. And then, though, another thing that could happen that would make improvements is that Congress was negotiating between the House and the Senate things that they agreed on to try to merge the bills. Those separate things that they already agreed they wanted to change could go to the Senate as a new bill. And because of this strange set of procedures, it actually could get passed with only 51 senators. Then it would have to go back to the House. So it's essentially the Senate bill could get passed and signed into law, and some fixes could get passed through another very small bill. And some of the fixes include trying to fully close the Medicare Part D donut hole. All of the bills actually make the donut hole smaller, and over 10 years start taking it down and down and down and down. But one of the things that they had agreed on is trying to find enough resources to fully close it within 10 years to get rid of that donut hole. So that's a fix that could still happen with the supplemental bill. So I said I was going to hand out one thing.